Thank you, Phil, for telling your story. This is, no other civilized nation in the world do people have to go through those kind of struggles to get access to basic health care. And every family has a story like Phil's, which is why this is such a powerful movement and such a growing movement for healthcare justice in this country. So I am with the Labor Campaign for Single-Payer Healthcare. Our mission is to move the labor movement into this fight, and we think that we have a really compelling case to do so. About 160 million Americans, slightly more than half of all Americans, get their health care coverage through an employment-based health care plan. And no other industrialized country in the world treats health care like that, treats health care as a benefit that's linked to your employment. Every other industrialized country in the world treats health care as a basic right linked to the fact that you live in this society, you have access to health care from birth until you leave this world. In this country, it's a benefit for most of us. It's a benefit that's linked to our employment or the employment of someone in our family. And this kind of came about as an accident of history. It was sort of a second best solution at the end of World War II. President Roosevelt had promised the American people that as the war was winding down, that there would be a second Bill of Rights and that the right to health care would be central to that Bill of Rights. But the system had other ideas, and after World War II, there was actually a very kind of a reactionary push in the other direction, directed at the labor movement and the broader New Deal movement. And in fact, those initiatives were defeated in the later 1940s, and the organizations like the labor movement that could have pushed those deals were substantially defanged. And so as a result of that, unions began to negotiate health care benefits and institutionalize those benefits into union contracts, and then they became very widespread throughout the workforce, so that more and more Americans got access to health care through employment. And this was a flawed system from the very start. First of all, and Dr. America really pinpointed this, it institutionalized racial and gender inequalities in the job market. So, jobs tend to be segregated, especially in the 1940s and the 1950s, by race and gender. Those jobs that had more people of color in and more women in tended to be the jobs, the segments of the labor market that had less history of incorporating health care and decent health care into employment. So you institutionalized all of these kind of inequalities and disparities into this healthcare system from the beginning. That's the macro picture. And then at the micro level, I mean, think about it. Healthcare linked to employment, you lose your job, you lose your health care. You go on strike, you lose your health care. Your kid maxes out in age, she loses her health care. You get sick, you often lose your health care because you're not working, and at some point your employer stops paying for it. So the people who need health care the most lose it under this system. It's not a rational system. And whatever you think about it, I mean, there are some people who really believe that that's the way it ought to be. Whatever your thoughts about this system, in the end, it's simply unsustainable. There's a employment consulting company called Millman Associates, which every year puts out what's called a Millman Medical Index that tracks the cost of health care. In 2018, they said that a decent health care plan for a working class family of four, a plan that provides pretty good health care, has a total cost for that family and the employer of $28,000 per year. So that's, if you ever negotiate contracts, you always break down costs by hour. $28,000 a year is $14 per hour worked for one worker in that family. $14 per hour, almost twice the current federal minimum wage, is going into health care for that family. Out of that $28,000, the employer is paying close to $16,000 as their contribution to employee health coverage, and these are responsible employers. and the worker and their family are paying over $12,000 into this pot through co-pays, through their contributions for insurance, through deductibles and co-pays, no pays, sometimes paid, prescriptions, out of pocket, in pocket, all of the ways they extract money from us. That comes to, on average, $12,300 per working family. And these are families who have decent health care. Those costs also have been going up 2 times faster than inflation consistently from the 1980s onward, and the amount of money that the family, the worker and their family are expected to pay has also been going up consistently faster than the employer portion throughout that entire period. And while unions have it better than others, because at least we can bargain for health care, and most other working class Americans have to take what their employer offers, everyone trades wages and other benefits for health care. And that this reality that we trading wages and other benefits for health care has been a major driver of wage stagnation and inequality in this country. Our wages have been flat for over 40 years. The wages of the bottom 95% of all Americans have been flat for over 40 years, while inequality has massively expanded. There was a recent Gallup poll that found that 61% of all Americans would be willing to trade 10% of future wage increases in exchange for a promise that their health care costs would not go up for 5 years. People are willing to trade their wages for health care. And employers know this. When we go to the bargaining table as unions, the employers know that our number one issue, the issue that motivates our members, that we have to have no matter what, is health care security for their members. And they use that issue as a threat over our heads in order to force us to accept substandard conditions and substandard benefits in other areas. So we say in the labor movement that when we bargain for health care, we bargain against ourselves, and that we have to move to a Medicare for all system because it's the only system that would take health care off the bargaining table by making it a right for everyone in America. I'm not a business person, but businesses have the same kind of pressures that I just described for working class families and for unions. You know, businesses that are responsible, and either because they're forced to by unions or they have some sense of responsibility to those employees, those businesses face huge competitive pressures to compete with employers who don't have these kind of costs for health care, these $16,000 per employee costs for health care. And they get undercut constantly in that world. So it reinforces this race to the bottom. It reinforces inequality because businesses are constantly forced to either cut health care benefits or cut other benefits in order to compete with low-road employers throughout the market. So when you're looking at various politicians' proposals for health care reform, one question that you really need to ask is, does that proposal break the link between employment and health care? Does it make it a right, a birthright for everybody in this country? Or does it assume that employers will continue to have the right to provide your health care through some employment-based policy and the responsibility to do so? And that's the fundamental difference between a Medicare for All proposal and all of these other health care proposals that sound really great until you figure out who's actually going to be paying for the health care and how it's going to be delivered. So that's the sort of labor business perspective. Now, Chrissy also asked that I briefly address the sort of the issue of taxes and how you're going to pay for it, because it's been blowing up as our movement has been building power. You know, the attack is that your taxes are all going to go up, and there's no way you can pay for this kind of a system. So I'm going to try to give you some quick bullet points on this. For those of you who are the wonks in the room, there is an excellent study that came out last year from the Perry Institute at the University of Massachusetts called An Economic Analysis of Medicare for All. It's the best study I have seen on this. It's a peer-reviewed study. It's over 180 pages. It really delves into the sort of deep analysis of both, how to pay for it and potential sources of revenue. And we've looked at that as we've tried to construct these, an understanding of how to talk to people about how to pay for it. And I want to also preface my comments with the warning that there are many schemes and proposals about how to pay for Medicare for all. There's a lot of ideas floating around out there. But as the chief economist of this University of Massachusetts study said, it's really easy to think about how to pay for something that costs a lot less than what you're currently paying for. And so the first premise when you're looking at Medicare for all is it's a lot less, even though it covers everybody and expands benefits and makes them comprehensive in ways that no other proposal does. And there's a lot of reasons why it's a lot less, but it is a lot less going forward. So I'm going to talk about the recommendations that Senator Sanders made about how to pay for his Senate bill on Medicare for all, because they're clear, concise, and simple. And Bernie has been talking about that on the campaign trail. He will say to people, yes, you're going to pay more in taxes, but your total costs are going to go down. So this is the Bernie proposal. And most of the other proposals have a similar kind of structure. There's 3 sources of funding for how to pay for a system that costs less than what we're currently paying. The first source would be all of us. How much are we going to pay into the system? We're all paying, average $12,000 in a family of 4. How much are we going to pay into the system? So Bernie Sanders proposes that there would be a 4% income tax on incomes, a marginal tax rate on incomes over $29,000 a year. So on your first $29,000 of income, you pay no taxes, then you pay 4% on all income over that. Then he proposes that all employers would pay a 7.5% payroll tax similar to what they pay for Social Security and Medicare, a tax on all payroll income. So employers would pay their fair share through a payroll tax. And then finally, he proposes a series of taxes on the rich. So if you look at those proposals, if you look at that working class family of 4 getting decent health care coverage, they're paying $12,000 a year. They're making about $90,000 on average. If you look at the, that family would be earning, they're making about $90,000. If they paid a 4% marginal rate on their income over $29,000, they would pay $2,440 per year in additional taxes. So your taxes go up, yes, $2,440. Your health care costs for that family go down $10,000. That family saves $10,000 in health care costs on Bernie's plan. 4% over $29,000, that's all you would ever pay for health care. No co-pays, no deductibles, no out-of-pockets. You pay 4% of your income. 6.75 or 7.5% payroll tax on a $90,000 employer-paid income. That's $6,750 for that employer. Those employers who are paying $16,000 now are going to save close to $9,000 a year. Now, Walmart might end up paying more, and McDonald's and those race to the bottom employers who are dragging all of us below, and that's why this system works, because not only is everybody in coverage, everybody's paying their fair share as we move forward. And then there's this whole series of, you could choose your own adventure on this, how we can extract some of the money that the rich folks have stolen for us over the last 45 years. And again, there's a whole series of economics on inequality, but just trust me, the rich can afford to pay their share in this Medicare for all system. There's plenty of sources there. So the other cool thing about the Bernie proposal, because it's simple to understand, is if you look at there's a chart somewhere in here, Chrissy, in the back of the room. If you look at that chart, you could figure out that right around $350,000 is the break-even point. So if your family earns less than $350,000, you're going to save money under Medicare for All. What's cool about that is that the median income, the 95 percentile level of median income for American families, the last time I checked, was $356,000. So we can say under this proposal, and under most proposals, 95% of all Americans will pay less. So these are the 3 points I just want to leave you with. Vast savings for working families. $10,000 for a family that's putting out $12,000 a year in health care payments. Vast savings for responsible employers who are trying to provide decent health care coverage for their members, and relief for those employers against the race to the bottom people who are dragging us all down. And 95% of us will pay less. 95% of us will pay less, and the rich will pay their fair share. That's all I got for you. Thank you.